The chair now recognizes the gentlelady from Florida, Representative Cammack, for 5 minutes of questioning.
Well, thank you, Mr. Chairman, and thank you to our witnesses for being here today. In 2020, Congress took an important step by finally replacing a decades-old outdated rulemaking process, as you know, with a more modern framework under the CARES Act. Now, this provided FDA a new administrative order system and resources to update monographs faster, supporting safe innovation in over-the-counter drugs. Now, this was a step in the right direction, as we can all agree, but clearly we have a lot of work to do. So even with this in place, we're hearing that innovation is still being stalled. Responsible companies are navigating a maze of delays, unclear guidance, and inconsistent enforcement. Meanwhile, bad actors continue to exploit loopholes, avoid user fees, and benefit from data that they didn't generate. So whether it's sunscreen, and there has been a lot of talk about sunscreen today, vitamins, or everyday cold and flu products, Americans deserve access to safe, effective, and up-to-date options. And manufacturers need a regulatory system that is efficient, fair, and importantly, predictable. So as we look to reauthorize, I'm interested to hear in how we can continue to improve the system, cut red tape, protect consumers, and reward responsible innovation. So I'm going to jump in with you, Mr. Menzel. Given what you've said about the number of facilities not paying for the fees and the link to poor quality products, it raises real concerns about enforcement. In your view, how can Congress ensure that the FDA is fully using its existing authority to crack down on non-compliant manufacturers? That's the first part. Second part is, what steps can be taken to reinforce program integrity without adding new burdens to the companies, because that always seems to be the answer, just throw more at them, right? That are already doing things the right way.
Yeah, thank you. I think the first and obvious is what we're all, I think, in alignment on today, which is reauthorize OMUFA. Right. I think that, that first step, I think, is essential. Whenever you think about the arrears list, I think there's, we've already mentioned 3 or 4 obvious items in terms of publishing the list, giving FDA guidance on what to do with those companies, inspections, priority inspections for those companies. I think that would move that along very quickly, and I think this committee can give guidance to the FDA as it's related to the arrears list. Mm-hmm. Your second question was?
So the second part was, you have companies that are already doing the things the right way. Things. We don't want to punish them by putting additional burdens on them to try to capture those companies that are not in compliance. How can we handle that?
Yeah, and I think it's an incredibly important point that we don't need more regulation as it relates
Thank
to
you.
this. And so there needs to be predictability. Mm-hmm. The OMUFA program allows predictability. The Monograph program allows predictability, allows for innovation, allows for speed. I think there's some gaps that we've all discussed that can be fixed, and I don't need to revisit those. But those key items, predictability, speed, and allowing for innovation, go along with not increasing regulations.
Okay. Mr. D, am I saying this right? D. Ruiz? Did I say that right? Sorry. Now, I know that sunscreen has gotten a lot of airtime today, as I mentioned, and listen, I'm a Floridian. I'm basically clear. I get it. I look at the sun, I burn. I hear everyone loud and clear. It's an important issue, certainly, for folks back home, but I want to get to the core issue when we're talking about this. No new UV filters have been improved since 1992. I was born in 1988. So since I was 4 years old, despite repeated input from industry and experts. So what is actually preventing FDA from adopting that input and moving forward? And what tools do we need, the incentive, what do we need in order to fix it?
Yeah, it's been a long time, especially for me. I've been working on
Way
it
to make me feel old there, friend.
1997. So yeah, it's been a long time, and there've been various iterations in the law with the, time extent application, the Sunscreen Innovation Act, culminating now with the CARES Act and OMUFA. Right? So now, finally, after all these years, we know what's required, we know what they need, and we also know that what they need doesn't quite jive with what's going on with the rest of the world. And if you do do the animal testing, then you are shutting yourself out from being able to compete in the rest of the world with animal testing bans. There are alternative ways of assessing risk, which the industry has provided FDA with a framework. We have done a lot of the legwork. Now it's a matter of looking at what's that framework is, how it can be applied, and we've conducted this using international experts that are experts in carcinogenicity, developmental reproductive toxicity, and these will submit it to the monograph in terms of the docket, but FDA is still reliant on the existing framework, which requires the animal testing. If we were be able to work through that, I think we will be able to make a lot of headway in terms of moving forward. And this would be something that we collaborate with, working tandem in terms of our people know sunscreens. We do all the testing. We know how to formulate. We create the molecules. We can provide a lot of the data that they require in order to make decisions more efficiently and effectively. But we need the incentive to do that. And I thank you.
Thank you.
Thank you. I yield, Mr. Chairman.
Gentle